Good morning, good afternoon, good evening, ladies and gentlemen. Welcome to this presentation. My name is Veronica Fortu. I am a DMP student with the Bramant University, specialty psychiatry, mental health, nurse practitioner. I will be presenting to you today stakeholder education plan for my project. Over the years, working as a hospice nurse, which I still do work. I currently work as a hospice nurse with Kaiser Permanente Hospice Program. Being a hospice nurse, I've come across numerous patients and families. This includes providers, myself, co-workers, peers, and a team of doctors, nurses, pharmacists with issues and problems, facing difficulty coming up with a plan of care to adequately manage cancer pain or pain for a cancer patient at the end of life. Sometimes we're having to transfer those patients to a hospice house where they are sedated with narcotics, sedated with IV pain medication, with fentanyl, sedated, Versed, and all of that, just to keep the patient comfortable. So the goal we're having difficulty in achieving the goal of comfort for cancer patient. Probably maybe other patients with other diagnoses, but for the purpose of this project, specifically cancer patients at the end of life. So what is going on in the community that we need to consider as we move on in this project? That more and more families are opting for complementary alternative medicine, and they're looking at places like India, Asia, and incorporating this treatment without the basic knowledge, without much education, research, scientific research, evidence-based research to back up any interactions between, mixing alternative medicine and conventional medicine. So 2 years ago, I watched a granddaughter administer Reiki to a cancer patient. This patient issues was pain, and the family was divided on how to go about it. Here am I with my conventional medicine, a comfort kit that comprises of morphine, lorazepam, haloperidol, basic cordial for constipation, with histamine for secretions. So the basic medications, they comfort kit, and the family is like, no, we're not gonna go there because we don't want to sedate our dad. So we're gonna try this. And I had to use my critical judgment and say, okay, we need to give patients the choice, right? This is about their care. This is about their loved ones. And this struck me and said, what more can we do? I seen this granddaughter administer this treatment, and the patient went for days without having to use a pain medication. He didn't need his breakthrough morphine. We didn't no need to administer any anxiety medication because he was not anxious. He was comfortable. He wasn't hurting, and so no anxiety. No, he wasn't restless. And so you see how we save costs by not using other medications, only through keeping the patient comfortable. And this brought about an interest in my project. The addition of Reiki therapy to conventional medicine to improve pain outcomes for cancer patients at the end of life. So we talked about what is happening in the community, how patients, families are looking at incorporating complementary alternative medicine. I'm going to introduce us to Essential 2. Permit me read my cheat sheet: Organizational and System Leadership for Quality Improvement and System Thinking. This is critical for DMP graduates to improve patient and healthcare outcomes as doctoral level knowledge and skills in these areas are consistent with nursing and healthcare goals to eliminate health disparity to promote patient safety and excellence in practice. The following stakeholders are going to play a very important role in the advancement of this project: patients and families, for research studies, for feedback, policymakers to lobby for more funds to implement this research, for providers in training, patients education, family education, nurses, doctors training, providers such as representative from Kaiser Permanente, which owns clinic in several regions in the country, providers such as CDC, representative of WHO, World Health Organization, National Institute of Health. We're going to tap into payers, insurance, Center for Medicare and Medicare Services, CMS, Kaiser Permanente, which is an insurance provider on its own, representative of these organizations. And these stakeholders are going to be needed to advance this project. So what am I proposing? Adding Reiki therapy to conventional medicine. Research will have to be done to see the side effects, how the addition will impact, conventional medicine. I've seen how it works with one patient. Is it going to be the case with across the board? That is going to need to be researched on, evidence-based, right? And so we talked about the stakeholders and their role, the importance, educational theory and conventional framework. Theoretically, Kathleen Koch-Haber's theory of comfort has played a very important role in shaping my personal philosophy of leadership and innovation. Koch-Haber's theory places comfort once more in the forefront of healthcare by outlining the role comfort plays in the lives of mankind as a whole. The theory has been the driving force behind my leadership goal as a DNP prepared scholar and leader. The theory also helped me identify the problem of my project. Theory is about comfort, and comfort would be at the center. If the patient is comfortable, pain-free, then maximizing cost. And that's the whole model of the comfort theory that helped me. Educational interventions. I'm looking at my time. Michael Porter made a presentation in 2011. He made a very interesting case concerning the value-based healthcare. According to him, one of the issues with healthcare is getting access, but the real goal is value. The delivery of good, valuable patient outcomes per dollar spent. If we're looking at patient outcomes, we're looking at the value, and we're looking at the dollar spent. He reports that administrative cost drives cost in the delivery of the process. Here, combining Reiki therapy and conventional medicine puts into motion a plan for the process. For a plan for the processes, activities, relationship that the system has to implement for the desired outcome to be achieved. So we already talked about what is changing, and we need to explore that in this research. Here, according to Michael Porter, healthcare reform is proving to be one of the defining issues of the 21st century, both for the United States and throughout the world. Let me borrow what he said. What determines cost is how unhealthy a patient is. A more better way means to cut costs is getting patient healthy. Lower cost value equation. If pain outcomes are improved, less dollars spent on narcotics, on comorbidities as we talked earlier, that happens as a result of inadequate pain control, managing restlessness, managing anxiety, constipation, and all of that, which reduces costs as well. Implementation of the plan. I will put some figures here. It is estimated, studies shows and research, it is estimated in the study that total yearly cost of pain in the United States ranges from $560 to $635 billion, and the total incremental cost of healthcare due to pain range from 261 to 300 billion, and the value of lost productivity ranged from 299 to 334 billion. This is a huge loss in terms of dollar amount necessitating a solution. There's therefore an urgent call for further new research and more changes in the healthcare system to effectively manage pain and cancer pain and the way pain is treated and assessed. Cost-based analysis for adding Reiki therapy to conventional medicine indicates that improved outcomes with decreased costs in Reiki master salary, which is only an average of 65,000 a year, comparative to what hospice doctors are paid. Mileage, and we put all of that, the figures remain available. It shows that there's benefit, and the turnover for cancer patient is 120 days. A cancer patient does not last more than 120 days. So we're saving more money if we add this therapy to conventional medicine. We're using less conventional medicine and improving outcomes with adding Reiki therapy. How is this plan going to be communicated? We're going to use emails, conference calls, video conference calls, face-to-face with patients, providers in the local area if need be. If emails with congressmen that are far away, email with providers, representative of the WHO, CDC, and the rest will communicate through emails, probably Skype, conference calls if need be. There's a project delivery plan that will be updated as the project progresses, where we have stakeholders, message communicators, schedule whenever, when we'll meet when we need to, will be communicated way in advance. Given the fact that this project is where Combat has a lot of information, I will not want to overburden the stakeholders with a lot of information. Just critical and very important changes will be communicated as we move along in this project. The researcher hopes to see research, evidence, become action in the form of a new policy, program, or decision, because not always are these hopes realized. And the successful completion of this project will require collaboration from every stakeholder. Thank you for watching. Thank you for your time.